Glad to have you join us on the show. If you're just joining us, it's still the conversation right here on Lagos Television. Now, this conversation, not until yesterday when I got the message, I've got no idea what antimicrobial resistance is all about. Well, having read about it, I think it's something we need to pay attention to. From definition I've read so far, it is a growing concern in Nigeria, posing a risk of increased morbidity and mortality, threatening the control of emerging and increasing range of infections that result from microorganisms. Well, I am not an expert, I'm just a broadcaster. Well, I've got an expert here in the studio, a pharmacognosist, Oyindamola, Awosola. It's a pleasure to have you join us here this morning.
Thank you for having me.
So we're going to continue because you spoke into the live show. Oh. So we're going to continue from there. So what exactly, for the benefit of those watching us at home, what is antimicrobial resistance? Or better still, what is antimicrobial? Let me swallow whatever tongue twisters we've got here. Resistance. Why are we talking about this?
An average household in Nigeria, like I said, there's somebody abusing drugs, abusing antibiotics, abusing antimicrobial in general, because antibiotics will narrow it to bacteria. However, people are not enlightened because one has headache or running tummy or something, and he runs to an antibiotic, he runs to an anti-malaria, because everything is said to be malaria. So it's a great threat in Nigeria, not just to household, even among poultry farmers generally, they use antibiotics to boost the growth of their livestock. So now somebody goes to the hospital, does a test, and realize that most of the antibiotics that are supposed to be administered to his present situation, there is a resistance already, to that. And he's wondering, I don't really take medications, I'm very careful. How did I get this? How did I get here? So Nigeria generally is predisposed to using drugs, whether it is prescribed by a physician or not. Yeah. Okay. So,
yeah, go on.
Yeah, thank you. So antimicrobial resistance is on the rise. Something that was created to kill bacteria, viruses, pathogens and all that. Now it can't kill, is incapacitated, if that's a word I can use. Yeah, it can't kill. These guys are building resistance to it. Adaptability is part of the characteristics
of
these
guys?
Bacteria, fungi,
parasites,
viruses, parasites.
Okay. So what happens when AMR sets in, and why this abuse? Isn't that because of the access that we have? You can just go over the counter, get antibiotics, get what's the other one that you mentioned for headache?
Okay, no, I just used headache in the instance. Yeah.
So the access is there. You can just go walk into a pharmacy now and buy antibiotics. So what happens when AMR sets in?
I think with the question you meant what can we do?
No. What are the dangers?
Well, long stay in the hospital. One has a wound and has to be treated, yet they keep administering antibiotics, there's no change. Someone who has gone for surgery, after surgery you need to take antibiotics so that you heal faster, and any presence of a foreign microorganism can be dealt with. And that person is still there due to sepsis or one or some other things. So you have a longer stay in the hospital, that's first. Secondly, there will be emerging diseases that will be unable to be treated. Now, we have methicillin-resistant bacteria and all of those. Most of these antibiotics, even before it is built, some of these bacteria are beginning to build resistance. What do? They are gathering coping mechanisms okay, this is what I think they are going to do next. It's just like you going somewhere, you want to defend yourself. You assume that, oh, this person will throw a fist first, so let me guide it. Or, oh, this person might bring out a gun, I can bend over. That's how this thing, abusing that drug, has made us. So the best way I think we can mitigate it, if I get the question right, is first building antimicrobial stewardship programs. Educating the public. If you use one, you are reducing the potency on your own life. And it's not just, like I said, it's not just abusing, going over the counter to buy these antibiotics. You might not even use the antibiotic until you have a resistant strain. Why? Because farmers are using it to boost the growth of their livestock. They're using it to boost, when you're going to give little doses of the antibiotics.
So we can also get it from what we consume?
Yes, we get it from what we consume. We get it from organic manures that are not well treated. We also get it from not using the drug appropriately. You're supposed to use this particular dose. And, some people, Nigerians, we are all Nigerians.
Once you take one or two,
Once you take one or two, you're fine because you're not seeing the symptoms. There's no manifestation of those symptoms. And you feel, okay, now I can do what I want to do. And you dispose, the rest. Or overusing it. That's ways that...
You've mentioned 3 ways. Perhaps let me summarize that to give some clarity to the conversation, because it's beginning to get interesting for me. One, you said, is if you underuse it, you might get resistance. If you overuse it, you might get resistance. Or if you ingest it from food and all that. So you have literally touched on all aspects of our lives in Nigeria, because that's exactly what we do in this part of the world. We self-medicate. We have government policies that don't really attend, or better still, we have lack of manpower to attend to all the farmlands in the country to check, or effective monitoring to check what we use for production of our food in the country, or even the storage itself, to the chemicals used to store some of these grains and all that. So where do we start from? Because you have so many parents that believe that this is what my parents use, this is what I use. They continue that tradition, they give to their kids. We don't need to go because of the cost of medication. We don't want to see the doctor to prescribe. So we also go to the pharmacies also, we also dispense because they want to sell drugs as well. So where do we start from? Do we start from government, or this education we're trying to bring to the people?
Everybody has a role, from government to individuals to community. Government would have to draft or create policies towards educating the public, the physician, put in check antimicrobial stewardship programs. Everybody listens to, whether radio, social media, everybody listens to, everyone has something to say on social media. You can use social media as a tool. So if you're taking this will be the outcome. And be responsible. The word be responsible for the outcome of your life. What happens in 5-10 years if you continue doing this? So the government has that. Secondly, the government needs to sponsor research. Research is the bedrock. If there's no research, there's no rapid diagnostic testing, some people would not even know that they are already resistant to anything. They just go across the board and buy. Then to individuals, the quality of your life is as important as the future that you're trying to protect. Now, there's headache, there's stomach ache, there's whatever, and one is going to use anything. And you said they don't want to pay for healthcare or something. Some of these antibiotics or antimicrobial are very expensive, yet people go over the counter to still get it. So sometimes it's not just about the finance part, it's just a mindset thing. this is how it has been happening. So let's just continue. Some people have newborns that they bulk with antibiotics because they don't want them to get infected. So from newborn stage to adulthood, that chain has already begun. Right. So then community, we have community health care, we have primary health care center and all of those. If people have been enlightened from local government to federal government that, okay, these things that we are using has an impact on our life. These things that we are using has an impact on our livestock, our plants itself, because everybody is tending towards natural medicine now. And, you know, when you use organic manures from animals that have been pre-treated with antibiotics, you're going to reduce...
You get it this complicated because honestly, every area of our life has one effect
or the other.
Yes, it does. It actually does. Because my discipline, you have to develop natural drugs. I get to source natural drugs, plant or animal products from farmers. Now, that same farmer has a poultry farm that he has been treating with one of these antibiotics. And I'm trying to go more organic because I want abundance of these phytochemicals in the plant, right? When you begin to check the microbiology analysis, you see that some of these things already carry. So,
it's substantial.
Let me just build more on Joshua's question. Let me build more on this question. As a country now, do we have any action plan in place to actually address AMR? And for a professional like you, how do we prevent people from having unhindered access to some of these antibiotics that you mentioned? Because even an illiterate will just walk into a pharmacy now and demand for, I don't want to mention any particular brand now, and he or she will get it without any prescription. So do we have any action plan in place as a country to actually address this? Then how do we prevent people from having access to antibiotics without prescription?
Nigeria has been implementing the WHO Global Action Plan on antimicrobial resistance by educating, you know, when you go to the hospital, you say everything, don't use this, don't do that. But I think there is more. We are more of community-minded people than, you know, people that would go, you know, an average Nigerian would not go to the hospital except it's worse anyways, right? So from markets, mouth to mouth, what's that called? You go to enlighten in the market, you go to places where you find an average Nigerian thriving. You know, okay, this is what you should do, this is what that would work more for us than just creating awareness in the hospital alone, creating awareness, trying to tell young people or pregnant women, you know, we have more pregnant women in the hospitals. So they get to learn that, okay, don't use it, don't use it. Rather, let's come back to our people. Let's do, let's be people-minded. Like, okay, this is who my people are. This is how we are culturally built. Markets, places, churches, mosques, in fact, shrines, if possible.
Shrines. So let me take this a little bit further, because this is the field you operate in. So I'd like to just perhaps get an insight into this conversation, perhaps something that will actually resonate with people watching us at home. And that is, do you have a story of a practical example of how antimicrobial resistance has given you the passion to talk about it, because you've seen it, how it has moved from one? We don't have enough statistics, we haven't conducted research to know the number of people that have died by virtue of antimicrobial resistance. But is there a story that you feel that can pass the message across from something you've seen or witnessed or heard in your field that makes us feel that this is the conversation we should have?
Thank you. So let me pick a story. I'm trying to blow out the person's name. All right. Okay. So there used to be a young boy who had wounds all over. So the mother would add any antibiotics or anything that she's told to put, rather than going to the hospital to seek help. Now, as at the time the wound was really assessed in the hospital, he was already resistant to virtually all the antibiotics that could have been prescribed. The implication is that he might stay longer in the hospital. He did stay longer in the hospital, and almost he lost the leg.
How old is this boy?
I'm trying to pull out.
Yeah, no, I didn't say you mentioned his name. How old is he?
About 16 years.
16 years. So he's literally almost out of secondary school, or even out of secondary school.
Learning to live again. So there are thousands of stories like that, from old to young to even babies. So people do not know that the harm we create by abusing or misusing these antibiotics, and it can even take lives. You know, imagine somebody who has abused antibiotics to the point that wants to put to bed, had a C-section, and has been administered antibiotics, over antibiotics. And yet, there's still sepsis, there's still one thing or the other. You know, the wound isn't even healing, you know, and apart from several other factors like diabetes and every other thing. Antimicrobial resistance is a story, is a story that everybody should know. It's something that everybody should know, that, oh, if you abuse this could lead to death.
So there's a figure here from the World Health Organization, and the WHO rates Nigeria as having the 20th highest age standardized mortality rates per 100,000 population associated with antimicrobial resistance across 20 countries. From some of the action plans that you mentioned earlier, are we really treating these AMR as we should treat it? Are we concerned as a country? Except people like you will come on media to come and sensitize people. As a country, are we really, really worried? Because I'm hearing about it for the first time.
Well,
so I can now imagine somebody saying at the grassroots.
So as a country, I would say we're trying. That's the word I can use. We are trying, but we have not actually hit the nail on the head. Because everybody, even people are wrongly informed. Somebody has a small itch, runs to, not even pharmacy, you can get drugs from anywhere now. You can go to the market. Is that loose? You know, you can go to the market and see a woman with piles of different kind of things selling together. If the agencies that are against them are there in the afternoon, they go at night. So people can just get something and use. And you know, probably is reacting to something, and immediately he gets antibiotics and uses it. At the end of the day, when this person contracts maybe something that is sexually related, you begin to see that the resistance strain are more. So I think we can do better. As a country, as individuals, we can do better. We can sensitize the next person. Somebody can just come up, oh, I have toilet infection. They said is, you know, they lay claims. There are different claims all over the places. If you've gone to the market, you will see one person with one speaker saying is S-Oreos, is this, is that. And people who did not even have these things will now begin to get antimicrobials from it for something that they've not even contracted. So they are even pre-treating before anything started.
Okay, so for those farmers that you mentioned earlier, do they have another option aside from using those antibiotics for their what is it called?
Plants.
Yes, they have several options. They can even use plants instead of using antibiotics to boost. There are plants that are filled with berberine and all of those things that can even help growth and prevent disease. Berberine is a phytochemical that has antimicrobial effect. So if that, let's make an example, a chicken or an hen, chicken is the meat, an hen has something. If you administer something that is rich in berberine, it should work for that chicken, and it will work because research has shown that it does work. Garlic has allicin. Allicin is an antimicrobial. You know, plants are alternative to those things. So it will prevent transmission of resistant strain to human beings. right? So using these plants as an alternative to help livestock is actually for now the best option. And education. Some of these farmers, you know, everybody's trying to strive in the country.
Or cut corners.
Or cut corners. So some of them are not even educated enough to undo those things that they are doing. So once they hear from somebody that is enlightened, probably somebody that's done animal science or all of those things, say, we use this. They just go and take more than the required dose and begin to ingest into their livestock. And they sell this out. They are not doing it only to treat the livestock. They are doing it also to boost the growth. There are some of these antibiotics that help boost the growth of this livestock. So it's a selfish reason to cut corners. That's the right word, sometimes. But I'm sure that if they are properly educated on this topic, they would be more enlightened and also find an alternative that is suitable to, you know, to manage their situations.
Okay. Who takes the lead here? Beyond the fact that you said government should sensitize the people, sensitize doctors, sensitize parents, kids, farmers, all this segment of the society. Who takes the lead? Who, beyond what you're doing now, who takes the lead in championing this cause? Who should be in charge? Who should be the first person to start?
I would say the government. On the chain, government, healthcare workers, individuals. Individuals are more important, but government will take the lead.
Why government?
Because the government has the power over its people.
I didn't know. I thought the people with the power, then government.
So power is transmittable. Like you can transmit power from the head to the foot, right? So if the government leads this, okay, this is a burden. How do we get it? You make policies towards eradicating that problem, right? Then individuals can now take leads. Oh, this is what I want for my life. Oh, this is why the life expectancy is lower. Let me begin to, you know, be responsible for this. Now, it's not just the individual that gets the result from that problem. People around him would also, you know, the burden is not just going to affect the government, right? It's going to affect people in the family, people in the society, people, you know, and that's it.
Okay, perhaps before we let you go, I would like to know personally, how do you want the messaging should be if I get home and I need to talk to someone? How do I convince them that, look, this is that an antibiotics? Because we've always talked about self-medication, how bad it is, but how do we talk about the specificity of this in terms of, is that an antibiotics? It might just be AMR or antimicrobial resistant. I don't think that will sink in. How basic do you think I can transmit that message to people so that they can understand?
Okay, in as much as I don't want you to put people in fear,
Because
but the truth
I
is,
am afraid now.
Fear sells.
As you're talking, I'm
in
thinking
this country,
about
I think
myself.
fear sells more than, you know, the truth, right? The basic thing is, have you been tested? Why are you using the antibiotics? Why are you using? Some people will even have headache and start using antiviral agents if
So
they are
we
not
should
enlightened.
go to the lab before knowing what to take.
Yes. If they don't want the burden, now this is where it comes in. If you don't want the burden of staying on queues, there are different telemedicine platforms in Nigeria now that you can book. You can even book your testing yourself from your phone, from the comfort of your home. They come, they take your samples, and they give you this result. You can speak to doctors. There are several telemedicine platforms.
For the interpretation of the result of the test.
They would interpret. You just, you know, money makes the world turn around. Stipends, you pay stipends, they get you a doctor. Okay, doctor, this is what is wrong. I assume. Anybody can assume anything. Oh, do you want to be tested? Okay, we send someone to your house, pick up your samples, analyze it and get it back to you, then a doctor is also at the end telling you, oh, this and that, before you should, maybe before you are advised to take an antibiotics. It's not everything. Permit me to speak pidgin. No be every headache, no be every stomach ache, no be every hand pain, no be every vomiting. Now it be malaria and typhoid. You know, typhoid has been implicated in everything, even in pregnancy. So that's it.
Okay. One other thing I would like to know is this. When you look at the quality of our healthcare service in Nigeria, it is quite poor and, of course, expensive. Is this not why people are trying to cut corners? Because if you have not eaten, where would you get the money to go and do your test in a lab or ask somebody to come to your house and take your samples? So what can government do in this direction to provide healthcare facilities in such a way that people will have access to some of these things and they will make it affordable for them?
I think our government, we are not there yet. Let me speak for Lagos State government. I think they are beginning to do a lot of things to ensure that people go to the hospital. Number one, if you look at some of our our hospitals, from primary health care to, you know, you would see that there's a lot of changes. People are there, the wait time is actually reducing, and there's not much burden. The monetary aspect, you have Lashma, Ilera Eco, for Lagos State, that, you know, you put in a certain amount of money and that covers some of your expenses. You can now, you know, maybe few things that you might want to buy. But most of the expenses, even surgery. So our government are beginning to put so many things in place. I don't think the system is as bad as we paint it. As somebody who uses government, I use government-owned parastatals for most of the things I do. And I know that that hospital 10 years ago is not the same as now. Everything is getting better. The wait time is getting shorter. You know, you see a doctor, you can even convince a doctor that I want to add this test to my test. You know, at the end of the day, you know, everything is getting better and they are getting more enlightened. So I do not think that our healthcare is as bad as we paint it.
All right.
Okay, I think there's hope on the horizon for. Also, I think the bottom line is all of us should just go to the hospital and do the needful, see a doctor before you self-medicate, especially when we're talking about AMR, antimicrobial resistance. I want to say thank you very much, Oyindamola, Awosola, for joining us this morning. It's a pleasure to. I'm enlightened. I didn't know about this. I think I need to. There's somebody I need to warn. Yes.
Here?
In my house.
Okay.
Yeah, because I think there's something fishy going on. Something fishy. Thank you very much.
I think you should warn the person. Thank you.
Pharmacognosist. Pronounce it again?
Pharmacognosist.
Pharmacognosist. Okay. There you have it. We'll take a short break. The conversation continues after this break. Don't go anywhere.